On my clock, it has the top of the hour, and I think this calls for a start.
It is mute. No, not.
I have opened the microphone, so I'm speaking now. All the world can hear us. So be careful on what you say. Welcome everyone to this launch of our report on a research study on loneliness amongst older persons in 6 countries in the Western Balkans and the Caucasus region. This study was done in 2021. We took a little while before releasing the report because we had an extremely busy agenda at the end of last year, but finally the day has arrived when we officially release this report. Before handing over the floor to our acting regional director, Giulia Valese, let me just say that at this point, I would like to express at least my deep appreciation for the great collaboration that has resulted in this report. And that includes the various NGOs and statistical offices in the respective countries. That includes University College of London, and that includes our own country offices in the participating countries. It has been a pleasure to do this work throughout the entire process. And I hope that this reflects in the atmosphere and the mood during this brief, 1 hour only, meeting and presentation of the report. With that, I would like to hand over the floor to Giulia Valese, acting regional director of the regional office of UNFPA in Istanbul.
Thank you so much, Edward. And it's so exciting to see so many participants from the 6 countries for this survey that was conducted, as well as from across the region. And I really would like to welcome also all the distinguished panelists for being with us today. We know that globally projections all point in a similar direction. Fertility rates will fall further, population growth will slow down, populations are aging, and a growing number of countries will experience population decline. Population aging is not unique to Europe. The United Nations Secretary General identified demographic change, including population aging, as one of the 5 mega trends that affect our common future and the implementation of the 2030 Agenda for Sustainable Development around the globe. But population are aging particularly fast in Eastern Europe due to a combination of increasing life expectancy, low fertility, and large-scale outmigration, or of often young people. By 2050, the share of people 65 years or older in Eastern Europe countries will increase significantly. In one case, even up to 30% of the population. Loneliness as isolation among older persons is getting a lot of international attention right now. This is in large part due to the spotlight of COVID-19, which has put on the effects of the pandemic on older people. Under our joint program on aging, UNFPA has been advocating for the rights and health of older persons within the UN COVID-19 response, along with our partners from WHO, UNECE, OHCHR, and HelpAge. But addressing loneliness must be a priority beyond the pandemic. Loneliness presents a major risk for the physical and mental health of older people and undermines efforts to promote healthy and active aging. Ensuring that people can age in good health and as active participants in society is key for addressing the demographic challenges countries in the region are facing and strengthening their demographic resilience. And this survey in particular helped us to better understand the risk factors for loneliness and what we can do to ensure that people feel less lonely in older age. We will hear more about the findings from Professor Keck in a moment. We believe the current attention to the topic during the pandemic is an opportunity for generating the political will to tackle loneliness and make progress in creating societies for all ages. In that sense, we welcome that the issue of loneliness is planned to be covered in the Secretary General report for 2023, as well as the upcoming Ministerial Conference on Aging in the UNEC region that will take place in June 2022 in Italy. WHO's baseline report for the Decade of Healthy Aging, which has just been released earlier this month, calls for innovative approaches to tackling loneliness and social isolation. Loneliness in older age is a symptom of a reality that is the exact opposite of our vision for a society for all ages. This vision projects a society where people grow old being active and in good health, where older people's experiences and contributions are valued and drawn upon, and where older people's rights and dignity are upheld at all times. The closer we come to realizing this vision, the better equipped we will be for tackling the profound demographic changes we are experiencing in the region. And this was also the message that came out of the Ministerial Conference on Demographic Resilience in Sofia in December. Demographic change, including population aging, is not a threat. It is an opportunity to build more inclusive, more just, and ultimately stronger societies. And for this to happen, we must recognize and make full use of the contributions older people can make in their families, communities, economy, and public life, and stop pushing people to the margins once they hit pension age. Instead of short-term measures, we need policies that are firmly grounded in evidence and are comprehensive and consistent. During this decade of demographic resilience, we will work closely with member states to galvanize action in the region for enabling countries to thrive in a world of rapid demographic change. And I would now pass on to Edward to introduce the next speaker. Thank you very much for your attention.
Thank you, Julia. And I know that a lot of, probably all of our audience is very eager to finally hear something about the results of this research. So without further ado, I would like to introduce Professor Tara Keck of University College of London to present, probably in a nutshell, but I don't know, we'll be a little flexible with time, the main findings of this research. Tara, the floor is yours.
Thank you, Edward, and thank you for the introduction to both loneliness and the study. I'm delighted to be able to present this today, and this is the work of a large number of people between UCL, UNFPA, and partners that we've been doing in the past year on loneliness in older people in Eastern Europe and Central Asia. So I'll start by saying, what do we think about when we think of loneliness? We have ideas about this. And very often would think of, somebody, for example, who's a widower or a widower, very often would be thinking of somebody who lives alone. And that wouldn't necessarily have close ties with family. So that could be because they have moved far away, or their family, like was described in the region, have undergone migration. And it's also not having social interactions or enough social interactions or close relationships. And these are the ways that we often think about loneliness. And for a lot of us, we think of it as common among older people. And that's particularly relevant given the demographics that were described in the introduction for this region, where there is a combination of low birth rates and high outward migration, where we have an older population. And so we first started thinking of this from a study that was conducted in 2019 in Bosnia and Herzegovina, where we were looking at characteristics of healthy aging in a socially engaged population. And so what we found is that when we talk to people, and these are people who are attending social events 4 to 5 times a week at these healthy aging centers throughout Bosnia and Herzegovina, and when we asked them, they had either very high or extremely high satisfaction with their family relationships, a similar percentage, 59% of satisfaction with their friendships. But even though they are satisfied with their family and friends, 75 of them, astonishingly, 75% of them reported that they often feel lonely.
Tara, may I interrupt you?
Yes.
We have translation in 4 languages,
so
simultaneous translation. Please slow down a little bit. Thank you.
No problem. So what we found is that astonishingly, 75% of people were reporting that they often feel lonely. And so this led us to the simple question, which if people are happy with their family and their friends and their relationships, why are they feeling lonely? Especially people who are engaged socially and going out and taking part in activities. So we wanted to follow up on this to understand why it is that these people were feeling lonely, or why people feel lonely in general. So the first thing we did was we looked into the evidence in the scientific and social science literature, and we asked, what are the reasons that people might feel lonely? And the first one is what we often think about with lonely, is that people have a lack of emotional support or belonging. So this is a question of, do you have someone that you can talk to about your daily problems and that you feel close to? And this is often what we think about with loneliness, but it's not the only factor that weighs in. The second one that we found is that there's a lack of social support and opportunities. And so what we mean by that is that with social support, that's, do you have somebody that you can meet up with and just do something fun with? And that could be get a cup of coffee, go out for the day. And do you have enough opportunities to do that? And what we know is that most older people would welcome additional social opportunities, but that these social opportunities are most effective at combating loneliness when they are targeted or they have a specific activity that is engaged. The next thing, which is very well established in the scientific community, is that loneliness can sometimes be resulting from a lack of social confidence. And so this just means that people are nervous when they're meeting new people. And this is particularly relevant for older people because many of our social networks that we have throughout adulthood are through, for example, our jobs or our work, through our children and activities and people we meet through there, or through our neighborhoods and our communities. And as people get older, they tend to retire. They often their children are moving out, or sometimes people will move away from the community they lived in to be closer to their adult children. And so what this does is disrupts people's social networks. And so a lot of older people are reestablishing social networks for the first time in what could be decades. And if people are lacking social confidence, it makes it that much harder to connect and really engage with other people. And finally, we found that there's evidence for a lack of tangible support. So this is people having the support that they need for their daily tasks. So that could be picking up groceries, preparing meals, cleaning up their house, or picking up medicine, or having someone accompany them on trips to the doctor. And so these are a small list of the potential factors that we're focused on here. But what's important to note is that all of these would require different interventions. So if somebody lacks social confidence, but you create an intervention to help promote emotional support, that's not going to solve the loneliness that they're feeling. And so what's clear is that you really need to identify the appropriate factor that's underlying the loneliness in each population before you can start to try and address it, which is, as we established in the beginning, just so important. So that's what we were doing. We then conducted a follow-up survey. And this idea of this survey is we developed a questionnaire that did three things. First, it quantified loneliness levels to allow us to understand those. The second is we asked a bunch of questions related to these relevant loneliness factors. So this will allow us to link loneliness to the factors that might be contributing. And also we collected a lot of demographic information so that we understand the demographics of people that are experiencing loneliness. We implemented this survey in 6 countries and territories in the region: Albania, Azerbaijan, Bosnia and Herzegovina, Georgia, Serbia, and Kosovo. And by doing the survey, this allows us both to do a demographic characterization and to help guide or target specific approaches to reduce loneliness based on the factors that are most prevalent in the population. And so I'm going to take you through just some basic results that we have. And so this is really the key results. The report is launched today, which has much more detailed results, and so people can look into that. But these are the highlights. So the first thing that we found is that, similar to what we found in our Bosnia and Herzegovina study, is 75% of the respondents were at least moderately lonely. So there's high percentages of people who are experiencing loneliness. I should state that the age group for this was between 65 and 85. So this is older people in the region. And within that, a subset of these people were severely lonely, so 18%. This is indeed a very high number and speaks to how important it is to consider this as a major issue. And so what we did is we had these loneliness measures, and we then developed a model to look at the relative contributions of many of these factors. And I'm going to talk just about a few of them today. As I said, there's more that you can look at in the study. But when we look at the relative contributions, we were a bit surprised by this. So the strongest contribution or the strongest factor to loneliness is tangible support. So people who didn't have tangible support or didn't have somebody to support them in their daily tasks were much more likely to report that they were feeling lonely. Next was social confidence, which was a bit less of a contribution. And then we had two others. One was this positive social support. So do you have somebody to do something fun with? And social interactions. So the majority of people did want more social interactions, but the stronger you felt about that was correlated with your loneliness score. And what's important to note is that the idea of emotional loneliness, or do you have someone that you're close to or that you can talk to, most people did not, that was not a good correlate. So that was not a strong contributor to loneliness scores, even though that is how we tend to think about loneliness in general. So when this is for the entire region, so all 6 countries pooled together, but what we found is that we had similar loneliness scores across the countries. So the distributions were quite similar, but the factors did vary a little bit, and the details of that are in the report. But I think that this really just points to the fact that it's really important in any given population before starting to develop an intervention that the factors are identified. So I'll go through the conclusions and then move on to our recommendations from the report. So we're seeing something similar to what's been reported throughout the world, is that in the Eastern Europe and Central Asia region, loneliness is a major issue with older people. And that's the case even for people who have these regular social interactions. So it's more than just getting people more opportunities. And that understanding the population's underlying factors is key. And this is something, if we're going to tackle loneliness, and we really do need to, given the mental and physical health risks that are associated with it that were highlighted in the introduction, it's really key that we understand this. And for us, sort of the most exciting or interesting result was that this tangible support is a strong contributor to loneliness in this population. And it's something that is somewhat underappreciated. But I think that what's exciting about it is that it's something that many of us can do to help address by helping out our neighbors and older people in our community. So I'll finish up with the recommendations. This is a subset of them and they're extended in the report. But the first thing is to create and test programs for increasing tangible support. And so the creation of programs is, this could be through volunteerism, intergenerational programs could play a role here. Additionally, I think that we could also have things like mobile medical units, but these do need to be tested because there's less evidence on how well they work. Establishing day centers for older people throughout the region. These have been very successful in Bosnia and Herzegovina, which I think Zedefa will speak to in the panel. But these are places where you could actually address many loneliness factors in one place. And it's a central focal point for people to come to get social support, tangible support, and whatever support they may need. It's also important to note that loneliness is not something that only occurs in older people. So thinking about health and well-being across the lifespan is important, and this really does present a lot of opportunities for intergenerational interactions through volunteerism and sharing across generations. And finally, as was stated in the introduction, it's critical to establish policies to protect the rights of older people and combat ageism, because any form of healthy aging has this as an undercurrent, and this is really critical. So I'll finish with the acknowledgements. As you can see, this has been a project with so many people involved. Most notable, Zelko was the co-lead on this out of the Bosnia and Herzegovina office. And in particular, we had a ton of support from the regional office from Edward and Marta. But it's been amazing to see the team come together to do this under incredibly difficult circumstances through an incredible amount of hard work. Thank you very much.
Thank you very much, Tara. This is really inspiring, and even though I know the report already, still I love to hear about it again. Let me just briefly summarize some of the key findings that you presented. The survey covered 6 countries: Albania, Azerbaijan, Bosnia-Herzegovina, Georgia, Kosovo, and Serbia. We had sample sizes. You didn't mention it, but I think it's still relevant to reflect on it. We had sample sizes of 1,000 respondents in each country. So the findings are significant, statistically significant in most cases for each country individually, and that is also the reason why some of the countries have their own national report on this survey, apart from the regional or sub-regional report. So overall, the findings are a rather shocking high percentage of 79% of older persons who feel at least moderately lonely, and probably even more shocking, 18% who are extremely lonely. Then you found that the results are fairly consistent across all of the participating countries, and that the lack of tangible support is one of the factors that can relatively easily be addressed and is one of the major contributing factors to these findings. Now, I have a lot of questions myself, and if we have time, I will indulge, but I think we should also be aware of our audience. And I am pleased that I've seen in the various chat messages presence of ministers, assistant ministers, quite a number of NGOs from the participating countries. That is what I saw flashing by on the screen. We have around 160, I see 167 participants on Zoom, and who knows how many are listening and watching as well, us on YouTube, which I think we can measure, but I do not know those numbers. So I feel increasingly nervous with such a massive level of interest. So I apologize in advance once I start messing up. But the point really is that we would like to give the audience an opportunity to share their questions or reactions on these survey findings, however summarized they were. This is only possible for those who are on Zoom. I apologize for those who are on YouTube, but this is the way the technology works. We will not entertain raised hands unless you mean by it a greeting like this. No, we will not give the floor to anybody in the audience. What we will do is we will collect your comments, questions, observations in chat. And then towards the end of this meeting, we hope to be able to present you or the panel or Tara specifically with a selection of the most relevant, the most interesting remarks and questions that came up. And I can see already that we will probably not make it within the span of 1 hour, but I think that is okay. All right, let me see. Yeah, that's right. I think we should move on now to our panel. We have a panel of experts to present their views and their opinions on the research and its findings. And today we have with us Zeydife Basic, Collective Impact Director at Mosaic Foundation, and she is one of the founders of the first healthy aging centers in Bosnia and Herzegovina. She has been with us for quite a while throughout the years, and we are very happy to have her amongst us at the panel. We also have Ms. Beatriz de Hombres, a senior scientist at the Joint Research Center of the European Commission, and Vitalia Gauchaite-Vitic, the chief of the population unit at the Statistical Division of the United Nations Economic Commission for Europe. So we will start with giving the floor to Sedeva and Ms. Basic, or Sedeva. You are coming from the first Healthy Aging Center in Bosnia-Herzegovina. Looking at this survey results, were you surprised, or does it confirm the experiences, what you have seen from your work with those Healthy Aging Centers? Please also tell us about the municipality center experience. The floor is yours.
Thank you, Edward, and greetings from Sarajevo, from Bosnia and Herzegovina, to all participants of this panel today. I'm addressing loneliness issues among older people that includes depression and anxiety, and even suicide was one of the key reasons why we opened the first Center for Healthy Aging in Bosnia and Herzegovina some 10 years ago. So I'm really glad that this topic is on the agenda of the UN Population Funds and the UN European Commission, because I think it's a very important topic to discuss. When it comes to results from the research, yeah, I'm a bit surprised, but in context of Center for Healthy Aging, because if you ask me about prediction of the results, I would say the majority of people will say they are not lonely, because I would refer to people from the Center for Healthy Aging who are coming on a daily basis, who have different kind of activities, and who, beside what they do in the Center for Healthy Aging, they have additional activities that they created themselves, going to the mountains, going to different kind of places for exhibitions, meeting in their own places. If somebody has a house at the coast, 10 people will go with them. If somebody has a house in the mountain, 10 people will go in that direction without paying anything. So there is so much socializing when it comes to Center for Healthy Aging, and I could easily say that the results are there, because almost on a monthly basis we can see in Bosnia opening of the new Center for Healthy Aging. But when I maybe dig a bit deep down, I can see some underlying factors that Tara was referring to, and I'm really interested to go further in the research in that direction. I would say that beside all this socializing that is happening in the Center for Healthy Aging, something that is not that visible is the mental health condition of these people that we have to tackle. They're there, they're happy, they you see the happy faces, but when they go home, it's the question mark, what's happening. And also something that Tara mentioned, and it's very important to research more about, is the influence of ageism. I think that's very important factor that we maybe younger generation don't see, but it's happening. Our people in Bosnia are struggling with that on a daily basis. So beside all these beautiful, factors and beautiful activities that are waiting in Center for Healthy Aging, the question mark is what once they leave, go home, who's there, what's happening on the street, what's happening in the shops, what's happening, they go to the cafe. I think ageism is something that is very important, and we should go in that direction when it comes to additional researches.
Keeper, my colleagues are looking at me with some anxiety. Eduard, you are going over time. No, but I still would like to follow up with the second question. And that is, we have this particular package of activities that is being done in the healthy aging centers. Could you think, or would you suggest anything that is not yet being done, but that might actually contribute to addressing even further this the loneliness statistics? Let's say expand the portfolio of healthy aging centers. Do you have any suggestions in that area? Thank you.
Maybe more involvement of the family members for those people who are coming to the Center for Healthy Aging, some kind of interaction with them, so we understand what's happening at home. We understand what's happening when people are not in Center for Healthy Aging. Maybe more involvement of psychologists in the Center for Healthy Aging. So they organized some joint sessions for people. I think there is a lot of work to be done in psychotherapy. It's very important. There is so much when it comes to, especially Bosnia. You have people who, some of them, they survived the Second World War. Some of them, of course, the war that recently happened in Bosnia. Now the corona. Then you have a lot of people whose children are migrated out of Bosnia and Herzegovina. So there is so many risk factors, I would say. There is so many trauma in people that, for me, I think one of probably the next possible activity or project will be focused on psychotherapy and going deep down into what trauma that is present everywhere. If you, for example, if somebody start a topic about the war or existing situation in Bosnia and Herzegovina, you can cut with knife the situation in the Center for Healthy Aging, how important it is and how visual it is. So when it comes to Bosnia, I would say this would be one of the next activity that we will do in Center for Healthy Aging.
But I have to move on. I would like to turn now to Ms. Dombre from the European Commission. You are in the process of developing a similar survey across the lifespan that will be implemented in the European Union, and that will also try to answer the questions on loneliness and social isolation of older persons. How do you think that loneliness differs across the lifespan? Oh, the floor is yours.
Thank you very much. First of all, good morning to all participants. So yes, thank you for offering me the possibility to say a few words first on this EU-wide survey. So indeed, in 2022, we will launch an EU-wide survey fully dedicated to loneliness. And I think this is going to be the first time. And this data collection will target the adult population, so not only the older people. And this is a project, this is a data collection, which is part of a bigger European pilot project, which include a number of activities from data collection to analysis of the risk factor of loneliness, but also of the impact of loneliness. And also we will work also on mapping of interventions. And so this is a way to tell you that loneliness is also very high on the European Commission agenda, if I may say. And so when it comes to your questions about loneliness across a different age group, I think Tara said it in the beginning. For a long time, loneliness, somehow, we thought that loneliness was only an issue for older people, right? But now there are more and more cross-national studies, or studies at least as data which covers the entire population, which tend to show that actually the relationship between loneliness and age is U-shaped. What does it mean? It means that loneliness tends to be very high among the young adults, and also high among the older population. Doesn't mean that loneliness doesn't occur at middle age, but it's less frequent, right? So this is what data tend to show. And then when, of course, the underlying factors of associated with loneliness among those two different age groups, young adults and older people, are different. Among young adults, of course, young adult is imply, gaining autonomy, leaving the family, getting contact outside the circle of the family again. And also all this can be challenging. And we have seen this during the COVID pandemic. We recently wrote a report on this where we see that the young population has been very severely hit by the pandemic in terms of loneliness. And on the other hand, we know, and this was already very well described, that loneliness among the older people is associated with some fundamental risk factor of loneliness, being health, or of course the reduced social network. So the fact is, and also, so this is a difference in terms of age group, and also we tend to see that loneliness among older people tend to be much more chronic, and this is what is worrying, while loneliness among the young adult tend to be more transient, more temporary. So yes, so that's will be a way to me to answer your question.
This is a subject that we could actually continue talking about much longer, but we just don't have the time for it. I would like to ask you a secondary question, or second question perhaps is the better way to say it, and that is about the relationship between technology and loneliness. I believe that I recently wrote somewhere that it was a double-edged sword with positive as well as negative impact on loneliness. Could you say something more about this? How do you see this?
Yeah, so I mean, as you said, we have seen a dramatic increase in internet use over the past 2 decades, right? And at the same time, more and more people are talking about the pandemic of loneliness. Somehow loneliness is becoming the hallmark of modern societies. So naturally, many people question the link between loneliness and social technology. And actually, there are two potential links mainly. So some argue that social technology, social media use somehow displace, offline connection displace face-to-face connection, and because offline connection do not have the same quality in terms of relationship, of course, this leads to more loneliness. On the other hand, social media use might be also associated with enhancing of existing relationship, or it can foster or create new relationship. So this is not, and if you look at the literature, at the scientific literature, this is, at the end, we know very little. Why? Because most of the studies are only correlational, so it doesn't tell you whether social media impact loneliness. And yes, and so it's very, and also the findings are very controversial and limited. The sample size of those studies tends to be extremely low. The fact is, social media, the impact on loneliness might very likely vary according to the use you make of social technology, whether you are active or passive, whether you use it to chat or something else. And when it comes for older people, still, although the literature is very limited, it seems that social media use is associated with lower loneliness and among this age group. It seems also that some studies tend to show that the use of social technology to tackle loneliness might be also a way out sometime. And actually in this new EU-wide survey, we will have a specific module dedicated to social media use with these ambitions to try to better understand the link between loneliness and social media.
Thank you very much. And of course, a prerequisite for technology use in most cases would be the availability of internet. Okay, I have to stop here. Again, I get warnings that we are running much over time. So thank you so much for your insights. Well, let us turn now to the last panelist for today, Vitalia Gaučaitė-Vičić of UNEC. UNECE, as most of you will know, brings 56 member states, covers 56 member states, which are quite diverse in nature. Yet many of them, if not most of them, have growing and severe issues. Well, severe is not the right term. Have growing issues with regards to aging. So, Vitalia, could you please elaborate about this diversity within the UNECE region and say something more about, in your perception, what are the macro and perhaps micro drivers of loneliness and how these things manifest themselves across this very diverse region? The floor is yours.
Thank you, Edward, and good morning to all. And first of all, I would like really to congratulate Professor Kirk and all the team, as well as UNFPA colleagues, for this study and for the report, which I read with a big interest. And I think that the period when it was done, this COVID-19 pandemic period, it might have exaggerated a bit the results of the loneliness severity, but not necessarily, actually. While reading the report and listening to presentation today, I was trying to picture the diversity of these survey respondents and also the distinct socioeconomic and cultural environments they live in. This is this macro element that comes in. And the many cross-national studies that were done on loneliness already in the UNECE region, actually more on the west side, on the European side, less on the Caucasus and Central Asia, found this big diversity actually between countries of the severity of loneliness. In the northern countries, it's about 10% by some studies. In the southern and eastern European, about 30% of the people older people who express this feeling of the loneliness in the numerous surveys. These surveys are done quite recently, also within some former Soviet Union countries. Let's say that were some other drivers, not only the ones that, let's say, Professor Kirk mentioned, were included, like hazardous behaviors and etc. That was giving this social cultural effect. The few things that surprised me a bit, but also I think in the presentation it was said, that the self-reported health and poor functional status and mobility differences don't really make a clear association, or even at all, are not significant. So this is an important difference, I would say, from what in other countries one can see, which is really one of the driving factors, the micro factors. From the macro factors, it is the strong and significant association between material deprivation and loneliness. It was seen cross-nationally. If you look at the cross-nationally, while in the survey, it seems that financial situation is not a significant factor. So I found it a bit kind of disconcerting for me, but probably there are some explanations depending on the expectations, depending on the environment. So we can see it as well. There is now also a set of the longitudinal studies that are done on the onset of the loneliness, or also increasing severity, because SHARE, let's say, a survey on health and retirement, provides quite a good indicators on the loneliness and the factors that you can follow over the years. And there is this impact of the bereavement, losing the partner, divorce, etc., that really very much enhances and it is actually across majority of the countries that comes into. Now, if we think about the macro level, so where the main things can happen, the importance of the neighborhood safety, it's a very strong element, again, mostly across the countries. Availability of services, amenities, and mobility. It's another element at the macro level that is very important, that at the community and the public policies level, it's also across the countries. And I think this tangible support element that came very strongly in your study can refer to this availability of services, amenities, and mobility infrastructure, because it's not only the volunteers and neighbors that can help you to get this tangible support, but also how well the service system is developed, social service, health service system, how well we identify people who are lonely and who need, and how we connect them. So these are elements I wanted to mention that are kind of cross-nationally quite present, but sometimes differ from this study. So I will stop here because time limit.
Thank you very much, Vitalia. And I think that your remarks actually give us a nice transition point towards shifting the focus from the data and the research towards what we do with this data and research. And that brings us obviously to the issue of policy measures and programs to ensure the rights of older persons and to reduce feelings of loneliness. And I would like to make the circle complete by going back to Zedeva and asking her, as an NGO representative, could I have one key message from you, building on these research findings and your experience, one key message that you would like to see delivered at the upcoming ministerial conference on aging that will take place in the UNECE region? Or in other words, what are the most urgent policy measures that you see that need to be adopted by countries? Please, Zedeva.
Thank you, Edward. So the short message will be something in the line with recommendations of this research that Tara already said. I would pinpoint the opening of daycare centers, centers for healthy aging, older people clubs, everywhere where it's possible. I will make sure that the governments seriously understand the consequences of what this research was telling us about. And I see several questions here about how to make governments going in that direction. I think we should bomb them with the numbers. The numbers are really too high to be ignored. So from my perspective, what I can see in the past 10 years here in Bosnia, Centers for Healthy Aging and similar centers, they work. They make a tremendous impact on older people, and they make a difference, and they are very cost effective. They are very cheap to open and to run. So I believe in Bosnia, this is already a fun fact, and many municipalities are ready to open it. It's just a question of time, but I would use this opportunity to also urge to all these countries present today and their governments to see this example. It's nothing space shuttle impossible technique that we use. It's very simple, it's very human, and it's very possible. So Centers for Healthy Aging in Bosnia and Herzegovina, UN Population Fund, and we have here also Institute of Public Health of Federation of Bosnia and Herzegovina. They are ready to share the information how to do it and the results so far.
We would like to seek your suggestion based on this loneliness survey or your own insights on this green paper on aging that the EU recently published and the EU pilot project on loneliness. What kind of suggestions would you have for UNECE countries to design effective interventions to tackle loneliness? It's a broad question, I'm afraid, but please feel free to interpret it as you feel most comfortable with.
In 1 minute.
Yes, okay, it's okay, shortly. So it's a broad question and I will broadly answer, okay? So to me, as a scientist and because I'm working on loneliness, I think that first of all, if you want to design effective interventions, not only for older people, but for all age group, you need to know what works to tackle loneliness across these different age groups. And what I think is that there is clearly a gap, an evidence gap on what works and what do not work, because most interventions are underfunded, they are short-term, and they are not evaluated. So my first advice when you want to address loneliness is to run more evaluation of intervention, and for this to collaborate with researchers and also to collaborate with lonely people, to discuss with them and to engage with them in order to understand what works for them, right? And then
for a very concrete answer to a very broad question. And I apologize for bluntly interrupting you while you were still speaking, because we are really running out of time.
I stopped there.
But you had a wonderful, concrete response. And that's why I felt it opportune to interrupt you. Thank you so much. Let us move over to Vitalia. And similar to the earlier questions, may I ask, sorry, I'm just moving a little too fast ahead. Vitalia, how do you see the work on addressing the work on aging, and any example that you might want to share that gives us a promise that Europe can go better and can go on scale?
As Beatrice said, that it's not enough evidence for many of the interventions. They're not evaluated and they're not really, we cannot say that they work or don't. But from the policymakers' view, from what we usually preach, I would say what we suggest to the countries in our studies when we go for our roadmaps or etc., we always ask them to see for the active aging element of their involvement. But the thing is, the neighborhood strategy is very important. The community is important, but not necessarily that will reduce their loneliness. It's important to provide that environment needed, but sometimes very small interventions from the community can be helpful. Let's say one example from the community in Israel that we did 3 years in a row of their special workshops. It's a simple community. In the community, there is a telephone number for their man called Uncle Misha or Uncle whoever, that any older person has on his or her fridge that can call when the bulb goes off or something happens or the milk was not delivered or something. And there is right away a response. So this kind of a small element that can really work, make a big step. But also what is happening is these public spaces. As I said, the safety of the neighborhood is extremely important. And if person is afraid to get out, to meet people, it is an onset of so this is community level intervention. At the population level, at the country level interventions, of course, socioeconomics it's an important element. See for that material deprivation is not there. Try to alleviate that material deprivation, which leads to many studies show that it leads to the loneliness.
Thank you very much, Vitalia. I'm burning with following up on these remarks, but we have to stick to the time. So I have to move over and give the floor back to Tara with the following, with the request for Tara to share one key message that you would have and would like to share after all this research and completing the study and what you heard from the other panelists. It's maybe a big question, but still.
It is a big question. I think that I would emphasize that sort of a combination of what's been said. There's a lot of things that can be done at the community level, but we do need to test things. So a lot of these interventions haven't been tested. It's hard to know what will work, and it's really hard to convince the governments or even local governments to fund things when it's not clear, which is why the Healthy Aging Centers are such a lovely model. They have they have evidence that it's been working over a period of time, and then they have the investment. So I do think that, you know, more research on what actually helps these what interventions work, and then also trying to focus on the community level to make communities more inclusive of people of all ages would be a key thing to address first.
Thank you very much, Tara. Well, we have been monitoring the chats and the comment functions on YouTube and on Zoom, and it has been very active indeed. So thank you all, first of all, for that. We also note that a lot of the questions that were put have already been answered in the course of the remarks made by the panelists and by Tara. But there are still a few questions that remain perhaps unanswered, or that could still be discussed a bit more. And I'll try to pick up some of these. Hopefully I am not messing this up too badly. So here we have the first question. Are lacking digital skills and internet access among the factors that contribute to loneliness? Now, the challenge is, who would be most eager or able or willing to answer that question? I just have the floor open. Start speaking when you feel inclined to say something on this in an answer to this question. Any of our panelists, please.
I could speak briefly to what we found in the report, which was a large number of older people just didn't have access. So it may be a contributing factor, but and this is the case actually for also the comments about health and mental health, we didn't actually have a lot of diversity in that a lot of people did have health issues. So it's not going to be explanatory when you have a wide range of loneliness to explain why the loneliness is happening, but that doesn't mean that it's not playing a role. And so I think that that's the case with internet, is that a large fraction of people didn't have regular access to internet or devices or the skills to use them. And so with that sort of trifecta of lack of access, it's really hard to know what roles it could play. Although Beatrice did allude to the fact that in other studies in other countries, that giving people skills with the internet, especially when we're thinking about during isolation and restrictions, that could be very beneficial. But that we just didn't have that level of granularity in this study.
Thank you, Tara. Any of the other panelists would like to say something more on this?
No, I just would add, I think what Tara said is just completely right. I just would add that I think this issue of digital skills is relevant among all the population, among the young adult new generation. We do not really have, I think, the issue of lack of digital skills on average. And in Europe, which of course is different, access to internet is extremely high in most of the countries.
Indeed, it is. Although I must say at this point that we found, for notably in Moldova, for instance, that amongst the older population, there was a high percentage in the rural areas, at least, who did not have internet access,
exactly.
who did not even have a mobile phone or any way to connect, even if they had internet access.
Absolutely, among the older population in particular, absolutely.
Vitalia, did you want to say something? I saw your...
Yeah, we just published our policy brief and had policy seminar on this digital gaps and aging in the digital era. And I think it is an important element that Beatrice made the point that we have really to disentangle the young population and the older population, and especially all the olds, 80 plus. So they are really less using the internet, having less skills, and to evaluate impact of it on the loneliness is very difficult. I agree with Tara on this, but we can look at the socioeconomic environment and the digital environment when we compare countries. That we can do. We can do not to have this granularity within the questionnaire, but to have the general contextual matter to look into it. One can do.
Thank you very much. Let's move to a second question. This question probably needs to be seen against the background of our region and the countries where the survey took place. We are talking about the Western Balkans, about the Caucasus, and in some cases, these countries are facing, call it, political challenges. I'm trying to be diplomatic here. State building processes are still underway, one could say. So the question really is that to what extent does the political environment have effect on loneliness? I'm not even sure if it is possible to answer this question, but please do give it a try. That's a difficult one. I realize it.
Maybe.
Yes, please, Sedeva.
Maybe political environment that is unstable, of course, will influence on social isolation and loneliness, because people will, especially older people, will tend to stay in their homes, not to leave their places, because they don't feel comfortable being, around. They will be influenced by what they hear on the news, and the news is not really what we lately hear here in Bosnia. The news is not really something good that you can hear. There are very negative news about the possibilities of the possible war here, Ukraine, everywhere, instability, political situation, economy instability, another corona pandemic. So people, there is a lot of influence of these news on them, so they tend to stay at home, being more isolated and being afraid to even interact with other people. So we can feel this in Bosnia and Herzegovina almost on a daily basis. What we do with Center for Healthy Aging, we really try to create the environment where everybody is welcome, where we celebrate all the religious holidays, so people feel we opening up while sometimes politicians are closing in their own ethnic groups, isolating people in that way as well. You don't belong there. There is your place in this environment. So there is a lot of influence.
Thank you, Sedeva. I'm so tempted to say some of my own views, but I'm moderating. I cannot do that. I'm not supposed to do that. So let me just move on to another question. We probably won't be able to go through all the questions because I have quite a list here. Let me make a selection. Yeah. We need to close down, I think, but we can extend a few more minutes, can't we? Or are we going to be shut off the internet? Anyway, one question is a definitional one, maybe one that can be quickly answered. What is the difference between loneliness and social isolation? How is it different? Maybe Tara, that is something for you.
So just briefly, social isolation is something that has been studied a lot because do you spend most of your time alone? So do you live alone? Do you not interact with others? Whereas loneliness is subjective. So do you have fewer social interactions and relationships than you'd like? And part of the reason that it's been studied and interventions have been tested less is that it's a little bit harder. You have to ask a lot more questions. It involves more engagement, as opposed to from a census, you can tell, people are living alone or not. So social isolation is an objective measure as opposed to loneliness, which is subjective. And they have different risk factors for health, in particular related to mental health risk factors. So both are really important. Both need to be considered and addressed, but they are slightly different.
Thank you very much. One last question. we have to address this because gender-based violence is a very important subject in the UNFPA programming. And we have a question that is asking about violence against older persons and how it influences loneliness. Did we get any insight into this within the framework of this research? Or from a different perspective, do any of you have any experience or knowledge about the extent of the interrelation between these two factors? So violence against older persons on the one hand and loneliness on the other hand. This is a question which should take 2 hours to answer, but please go ahead. Floor is open.
We did have, I can speak briefly to say that there wasn't an obvious result from the survey. We did have a question about experiencing violence in the previous 2 years, but we had a small number of people who disclosed that. So there wasn't enough data across even this large population to really be able to make conclusions. So in this particular report, there's not strong issues, although, or not strong conclusions to be made, but that doesn't mean that it's not a very important factor.
Thank you, Tara. Yes, Vitalia.
Yeah, I agree with Tara that it's very difficult to gauge this in the surveys because the question is not, it's not enough data for that. It's only as a general contextual matter one can be considered in most cases. And I haven't come across a study that would really look association strongly. I haven't seen such a study, even though I looked through many of them. And I don't think that there was such a study specifically designed for that. That would include specific and try to get really the answers for that.
Thank you very much. Does any of the other panelists want to add to this?
No, I just wanted to add, I think it's indeed a very, very important issue. I'm not myself very much aware about what the evidence say about this, but I think it's a good point. And for instance, in the context of this EU-wide survey, this is perhaps something we could consider to at least try to address with some items. So I think, but yes, I agree. It's a very important question.
And perhaps I should ask it specifically to Sedeva, from your work with the Healthy Aging Centers, have you come across instances or acknowledgement by people, by visitors to the centers with regards to violence against older persons? Or is it too much of a taboo?
Actually, it's not taboo. There was one period of time, I think it was like 2016, 17, 18, something like that, where the violence in for example, Sarajevo Street against older people was very, very high. That high that we were bringing local policemen to give the lectures about how to recognize the violence on the street, how, what to do, even, some tips and tricks like don't show your jewelry, a bag, don't, be careful when you dress out, because you had the thieves who just hug the person like, you know me, and then they will take, the bag or something like that. It was very, very high. So we, as I said, we called the police to be to do some preventive work. When it comes to violence at home that comes from the relatives, this is a taboo. Definitely, it's a big taboo. Nobody wants to talk about that. They will protect the members of their families, and this is something that is high taboo for at least for Bosnia and Herzegovina, at least as far as I know, even in the Center for Healthy Aging. If it comes from somebody else in the street, some intruder, thief, they're going to talk, but when it comes to the relatives, a big taboo.
Thank you very much, Sedeva. And with that, we really have to close down this session because we are already significantly over time. I want to thank you from the bottom of my heart, these wonderful panelists, all the people who have contributed to this research, and Professor Tara Kek, Sedeva Basic, Ms. Beatrice Dombre, Vitalia Gaučaitė-Vitič, thank you once again so much for your contributions, for your time, and for sharing your insights, as well as all the participants who joined us today in chat and in comments. I apologize for not having been able to address and also synthesize all of these many comments and questions that were put. We do hope, however, that you will continue posting your views and your insights and your opinions on this event by the various hashtags that exist. You know, I'm not from the generation of the social media, so you can hear that in my remarks. And that brings me to the end of this session. Once again, I would like to thank everyone very much, and we would hope to have a continuation of this work with hopefully a follow-up study. As Tara mentioned, longitudinal insights are probably even more powerful than snapshots, but now I'm talking really beyond my own limits. We will continue working on this subject, definitely, that's for sure. I wish you all a very nice continuation.